Hi everyone, welcome back to my channel. Today in this video I will teach you about STI color coded kits. STI color coded kits. Now there are generally 7 kits, but now one kit has been added, so making it a total of 8 kit. Kit 1, 2, 3, 4, 5, 6, 7, and now one has been added, so there is 8 kit. Now kit 1 we will talk about, which is gray kit, which contains 2 important medicine. AC, you can remember AC. Gray kit for the cervicitis. Gray kit is for cervicitis, cervical discharge, and the mnemonic is AC, that is azithromycin and cefixime. Azithromycin and cefixime. Next is green kit, which is kit 2. Kit 2 is the green kit, which is for vaginitis or vaginal discharge, that is green kit. And you can remember green vegetables, so vaginitis, you can remember green kit for vaginitis, vaginal discharge. And vegetables are safe food. So from that S and F, you can remember the 2 important medicine, secnidazole and fluconazole. Secnidazole and fluconazole. Next is 3 and 4. You will discuss about 3 and 4. Both kit is for genital ulcer disease. Good. It is for good or genital ulcer disease, non-herpetic, okay. Then where is the difference between the white and the blue kit? 3 and 4. 3 is the white and 4 is the blue. So how can you differentiate between 3 and 4? 3, in kit 3 we use penicillin, but in kit 4 we do not use penicillin. In blue kit we do not use penicillin, we do not use pen. We do not use penicillin, that is blue coloration. So you can remember blue color kit, which is pen, and pen means we are not using the penicillin. You can remember like that. So kit 3 is the white one where we use the penicillin, and kit 4 is the blue one where we do not use the penicillin. Okay, now what are the important drugs in kit 3 and 4? You have to remember kit 3 contains penicillin, azithromycin and distilled water. You can remember bad mnemonic. Good, that is genital ulcer disease, and from good you can remember bad, that is benzyl penicillin. Along with that you have azithromycin and the distilled water. Bad, you can remember benzyl penicillin, azithromycin and distilled water. In case of kit 4, I told you, you cannot use now benzyl penicillin, you cannot use penicillin. So from the bad mnemonic, B is for blue, B is not now for penicillin, you cannot use penicillin. Now you have to use A and D, A for azithromycin and D for doxycycline, azithromycin and doxycycline. Now kit 5, which is very important, is red color kit. Kit 5 is red color, which is for herpetic lesion. Her, you can remember herpetic, red coloration. Her is C, she is very angry, you can remember like that. So red coloration kit. And it is for herpetic lesion, so you need acyclovir. You need to give antiviral, everybody knows acyclovir. Next is 6 kit number, which is basically the yellow color kit. It is yellow color kit for abdominal pain, for PID, abdominal infection, lower abdominal pain, you are having infection. So yellow coloration, you can remember yellow coloration, pain in the abdomen, you should be giving, yes, metronidazole. You should be giving metronidazole. Along with metronidazole you have to give the cefixime and doxycycline. Cefixime and doxycycline. You can remember like the mnemonic CMD. C for cefixime, M for metronidazole and D for doxycycline, CMD. Next is kit 7, which is black coloration. And what is the use of this black kit? Inguinal bubo. Always remember inguinal bubo. That is black kit. Kit number 7. The mnemonic is AD. Okay, A for azithromycin and D for doxycycline. Azithromycin and doxycycline we use. And the last kit is kit 8, which is brown kit. It is for anorectal discharge. This is the new addition kit. kit 8, which is for brown kit anorectal discharge. And here we use CD. The mnemonic is CD. The mnemonic is CD. That is cefixime and doxycycline. Cefixime and doxycycline, CD, is the mnemonic for brown kit, and that has been newly added. It is kit number 8, which has been added newly for anorectal discharge. Mnemonic is CD, cefixime and doxycycline. So these are all the different kinds of kits, and these kits are actually asked in important examination like NEET PG and FMG. Thank you so much for listening. If you are new to my channel, please subscribe this channel and please make a thumbs up. Thank you. Thank you.